News: 4 more people have succumbed to the COVID-19 disease, raising the country's death toll to 148. The worrying figures were released amid plans by the government to decentralize testing for coronavirus across all counties to aid in early detection of the disease, thereby enabling the regional administrative units to better handle the outbreak. Confirmed cases in the country now stand at 6,366 after 176 more people tested positive for COVID-19 in the last 24 hours.
With the recent announcement by the president that the reopening of the country will be dependent on many factors, among them the preparedness of counties, spotlight has shifted to the devolved units, even as they seek to attain the requirement of a minimum of 300 isolation bed capacity.
These 300 beds are not just simple beds. There is a proportion of them that are going to be set up as ICU beds, together with all the other supporting equipment that is required, the ventilators, and other equipment, the monitors that will be required for those who are critically ill.
Another headache facing the Ministry of Health is the capacity within these administrative units to carry out COVID-19 testing, with only 28 facilities operational in the country, with efforts ongoing to bring the service closer to the people.
So we will continue to support decentralization of testing and bringing the testing closer to the people, because, as you know, this test also that we use, the RT-PCR, has a turnaround time of about 4 to 5 hours. It makes sense, therefore, to get it down there where it can be done immediately and the results obtained in good time.
Out of 2,419 samples tested, 176 positive cases were reported, with the total caseload now standing at 6,366. On a positive note, 26 people made full recovery, with the total of recoveries now rising to 2,039. On a sad note, however, the total number of fatalities rose to 148 after 4 more people succumbed to the disease. Nairobi had 99 cases, Mombasa 20, Kiambu 17, Migori 13, while Uasin Gishu had 10 new cases, with Busia and Kajiado having 4 cases each. Meanwhile, with tuberculosis being the 5th leading cause of death in Kenya, the ministry launched 2 policy documents to guide efforts aimed at fighting the disease in the country.
This new approach will ensure that latent tuberculosis infections are treated and protected from developing active disease. In addition, this adoption of an all-oral treatment for multi-drug resistance that replaces a painful and toxic injection that patients had to endure previously, it makes it easier for patients to tolerate and to adhere to this treatment.
Nancy Okware, Channel 1 News.